function. A lot of people have shoulder pain, back pain, neck pain. I've been a physical therapist for over 30 years. Before that I was a health and physical education teacher, and I see kind of a melding of both of those professions and what's going on in healthcare today. Recently I wrote an article that's going out in the next newsletter that's going to address the situation we have in America. You know, everyone talks about this healthcare crisis, but we have to start to come up with solutions. And the solutions come with trying to educate people what's wrong with them, try to find out the causes of things like back pain and sciatica, the causes of arthritis, what causes people to get diabetic, what causes people to have heart disease, you know, cancer, diabetes. So it goes way beyond just taking care of one body system. It's about keeping your whole body in shape. And it's about, you know, eating right, and, you know, we have muffins this morning, but, you know, we have to look at moderation. We just can't go cold turkey on everything, but there is, you know, good food that you should eat, and there's also, it affects your body, and everything is multidisciplinary. In other words, I worked with professional sports, and I learned a lot, you know, working with the Pennsylvania Ballet and the Philadelphia Eagles over the years about nutrition, diet, exercise, and why they heal faster, and what makes healing occur. And I'm here to talk to you more or less about back pain and sciatica and how it affects your life. You know, as you're young, you can go out and you can run, you can do yard work, you can do tennis, golf, all those type of things that you love to do. And then as we get older, we start to have declining health, and we start to have back pain. And, you know, we wake up in the morning, we go, okay, it's Tuesday morning, I'm going to go to work. By 10 o'clock, I'm going to start to have this achy back. By 2 o'clock, it's going to really bother me, or I have to go for a long walk today, I have to go to the mall, go shopping. I can't walk, you know, like I could before. I can only go 10 or 15 minutes, and I got to think about sitting down. So I'm trying to address those problems, talk about why they happen, and what you can do about them. And we have to kind of work together, you know, and that's the best people I work with are the people that do the things that we talk about that will help them at home. And they often say to me, you know, if you worked with these professional athletes, how come they get so better so fast? And how come it takes me so long? Well, it's because they've been in condition all their lives, they've been eating right, they exercise, and their therapy is every day, 3 times a day. So they're really getting the best kind of care, whether they want it or not, because they're getting paid a lot to play that sport. But us normal people out there, we have to do more at home, do our home program, and to get better and to get better function. So I'm going to start by talking about the 3 causes of back pain and sciatica. The first one is called a herniated disc. And if we're looking at the spine, the most common areas where herniated disc in the low back will occur is between L4, L5, and also between L5 and this is called S1. That's your sacrum. This is the front, which is your stomach. This is your back, and in the back here you also have various joints back here. So they're called your facet joints back in here, but you can see the nerve roots come out. In terms of herniated discs, what is a herniated disc? A normal disc starts to looks like that when we're 20 or 30. It is this area right in the center. That's called the disc, and it's about 90% water. And when you're 20 years old, you're at your maximum height. 20, 24 years old, you're at your maximum height, because overnight, that will fill up with fluid, and it'll actually act as a shock absorber for your spine. And that's why when you get up in the morning, you're taller. When you go to bed at night, you're small. You shrink. And what happens is that is the shock absorber for the spine. This is an example of a herniation that's starting to develop. What happens is this disc sits within these cartilage rings, and over time, by doing repeated bending, or bending where we bend and then we rotate to one side, that increases what they call hydrostatic pressure in there. So if you do it enough times, bending over and over and over again, that disc starts to migrate backwards, and it can go to the right. If you turn a lot to the left, it can go to the left if you turn a lot to the right, or it can go straight back. And when it goes straight back and it herniates, it can hit the spinal cord, or it could go to the left and hit the left spinal nerve root or the right spinal nerve root. And people want to know why it hurts so much. See this, the size of this nerve root, how swollen it is? That's what happens to the nerve root when it gets inflamed. That's a normal nerve root. And it's usually the most significant time is under the age of 35. A trauma can occur, a car accident, a bad fall, like falling down the stairs, or repeated heavy twisting and lifting. It happens a lot in construction work. I have people that work in construction, and they're constantly bending over and throwing things. I had a gentleman that came in this week who was building furniture, and he was lifting plywood all day like this, and he finally ruptured his disc and has a herniated disc. Interesting though, there's 3 levels. There's normal, there's a bulge, and there's a herniation. A bulge just means it's broken through some of these rings, but it's not all the way back and hitting any nerve root. But the interesting thing, if you take 100 people on the street, 80% will have a bulge or a herniation, but they'll have no pain. Okay, you see a lot of people walking around who have problems that come in and they have achiness, but they really don't have leg pain. This causes a thing called sciatica. See this nerve root coming out? That's L4 nerve root. Here's L5 nerve root, and then down here there's another nerve root called S1. Those 3 nerve roots are the sciatic nerve, or make up the sciatic nerve. So when people start to get pain, they can usually, it's very pinpoint. They get it into their butt, down the back of their leg. It can even radiate to the front here and down the foot, or it can go down underneath the foot. Okay? When people come in, they go, everyone goes, oh, you need to get an MRI. All right? What we basically do in a screen is we want to see if those nerve roots are so impinged that they're causing 3 things. 3 things are red flags that make you have to get an MRI. One would be loss of sensation. In other words, I can't feel my legs completely numb, or I have numbness that goes down a distribution through my leg. I have weakness, okay, weakness, numbness, or the other thing is an inflammation. So loss of muscle strength. A lot of times I'll have people walk on their toes, and that's the calf. That goes to S1. I have them walk on their heels like that. That's L5. So that screens that out. And the other thing is somebody who has weakness in their quadricep. That's L4. So we do screenings to check out whether those nerves are involved. So that's basically what happens, but it happens characteristically in somebody that's under 35. You do see it in people that are 40, 50, but they might also have other issues. So that gives you an idea of the first cause. This is the second, arthritis, which is inflammation of the joint, and there's actually 2 kinds of arthritises. One would be rheumatoid, which is systemic, which is an autoimmune disease where your body is basically attacking the joints. We're not going to talk about that pretty much here, because that's really a rheumatology type of discussion with a rheumatologist, because it's a systemic problem and it affects all your joints. You heard all over with rheumatoid. But with osteo, it's really isolated to a certain joint. Degenerative disc disease, that's basically a degeneration of the disc and loss of that water content I'm talking about. This would be an example right here of degenerative disc disease. You see how much they've actually decreased in terms of the space here. You also start to get some lipping in here, and they call that that condition osteoporosis and advanced osteoarthritis. So you start to lose bone density, and you start losing the disc height and the space where the nerve roots coming out. I talked about 3 things that you need to, if you need to get an MRI. I said weakness, numbness. The third one is loss of reflexes. Okay, you know when you go to the doctor's office and they hit your kneecap and it moves like that. That's your patellar reflex. If the nerve is hit, that reflex doesn't work. If the nerve is compressed, the other one is down here in your Achilles. So that's the S1 nerve root reflex. So this reduced disc height, what's the problem with it? The foramen is narrowed on a 3-dimensional, this is the foramen right here, okay? This hole where the nerve root comes out, all right? And stenosis can also occur where, stenosis just means narrowing, and you can have, because of that disc space dissolving, you know, it's basically going away, there's not much room for that nerve to come out. So you end up pinching that nerve. A lot of people will complain of pain and tingling. It's a broad-based, often in both legs. Both legs can be weak. That's more a lot of times in the case of somebody who has central stenosis. This is the center of your spine here. That's the canal where your spinal cord comes down. Sometimes arthritis will develop in that as well, and then it'll put pressure on that. So what kind of problems do you have? People are walking over carts in grocery stores. You see them walking like this because they're trying to get more space for their nerve roots. Okay. Very stiff in the morning in the low back, because what happens over time is these ligaments will start that go from, what holds the spine together are these ligaments that go from bone to bone, and they create stability. If you didn't have them, you would be unstable and you would move too much and aggravate nerves a lot more. So those ligaments start to tighten down. So you see that a lot. So the biggest problem is it's over. You see some people over 50 get it. Pain with standing and walking, relief with sitting. All right, so that's very important to note. You know, people who come in and they'll go, I can walk for 10 or 15 minutes and I just have to sit down. What can you do for something like that? You have to do a few things. You have to realize that this is what's going on with your spine. They come in, if I was looking at the back, this is where your pelvis goes, okay? This is the front of your pelvis, this is the back of your pelvis. That's that little point you feel here, and you know that little dimple you have in the back? That's they call it the anterior superior iliac spine, this is the posterior iliac spine. But these, when you're standing, they should line up parallel to the floor. And why is that? This vertebrae is L5, okay? I'll give you a couple of them, I'll put them up. Okay, so this is L5 and L4 that we were talking about, okay? If you're standing like that, your pelvis is lined up like that, it's neutral to the floor, all the weight of your body is going right over that. That's a good scenario, okay? What happens with stenosis is over time, people will start to have pain, their abdominals get weak. When their abdominals get weak, remember we were talking about they like to sit? So they sit, right, in a chair. Their hip flexors get tight. Some of your hip flexors, when you do this, some of those muscles go to your spine and they insert here and here. So it pulls your spine forward. That's even worse because now these nerve roots are getting more pressure. When the person stands up, they're like this, okay? So where's the weight going? It's going on these joints that aren't supposed to have the weight, and they start to get arthritic. Okay? So they get relief by kind of trying to open those joints up. So there's a couple things you have to do to try to correct that. And there's a whole treatment system behind that. But what you have to do is you have to stretch their hip flexors so they're not like this, and you have to teach them to do like a tilt when they walk.